Together, we are Grand Prix Body WoRX, made up of 3 facets. I am a physician, doctor of osteopathic medicine, so I oversee all things a physician would do, and that's usually, in terms of our business, aesthetics and wellness. And I have been practicing for 2 years.
And my name is Mowery. I'm the strength and conditioning. I oversee the one-on-one personal training, the nutrition, weight loss programs, boot camps, functional fitness. I've been training people, specifically athletes, for over 10 years. Before moving to Wellington, I was a strength and conditioning coach at a university. So I was working with a lot of different teams, multiple athletes, and down here, sports specific, so working with equestrians, and then one-on-one personal training with the general community and population.
And my name is Jackie. I am the doctor of physical therapy with Grand Prix. I do injury prevention, treatment of injuries, whether that's acute or chronic, movement assessments, dry needling, cupping. I've been practicing physical therapy outpatient for 5 years, treating a lot of sports athletes and Parkinson's. I did a lot of neurologic stuff prior to going more sports-centered.
It was a very long road, but I ultimately decided it was what I really wanted. I just really love working with patients. I just really enjoy getting to know each patient that I go and see in their homes and getting to know their family or even their pets, and just talking to them about their goals ultimately and deciding, doctor to patient, deciding together what our goals are going to be and like what procedures we're going to do and steps that we're going to take like in their daily life outside of me to get there. And that's kind of where it couples with the other 2 in the group, because then they can kind of take, some functional fitness and some physical therapy along with actual like internal medicine or aesthetic medicine, whatever it is, and kind of come together as a full package to feel their best selves.
So I was a big athlete all through high school and college, and so I pursued a degree for elite athletic performance, strength and conditioning, sports nutrition, and followed that path into training athletes at a university. And I really just enjoyed working with different sports disciplines and being able to train them one-on-one and also together in a group setting where they were competing against each other off the playing field, but then also getting to see their success on the playing field. And then with one-on-one training, just helping people reach their goals, whether that's picking up their grandkids or a weight loss goal, something that they've been struggling with, just making them feel better, similar to what Victoria was saying, but on a physical fitness side. So, and then, I got into doing some chef work. So now working with nutrition, steering young adult riders in a positive relationship with food, doing some meal prep, that sort of thing, couples nicely with the strength and conditioning aspect.
Mainly it was a love for just helping give people their life back and letting them do the things that they love to do, hopefully getting them to a point that it's pain-free and that they're not having, the difficulties that they were having prior to doing the things that they love. I knew that I didn't want to sit behind a desk all day, and I wanted to get to know my clients or my patients. So I kind of fell in love with physical therapy because I don't have to sit behind a desk all day. I get to talk to people and I get to help them accomplish their goals. But it's really, really cool to get to work with someone who from like start to finish, like they come in and they're like, gosh, like I can't do, I can't pick up my grandkid, or I can't do this because my shoulder is killing me, or I have all this neck pain and I can't do it, or I can't get on the floor like I used to be able to spend that time with my family. But being able to see them go from that and then work with them and kind of teach them along the way about, different methods and strategies that they can incorporate throughout their day just to try to make some of those everyday tasks easier. So it's really, really cool to get from the start to the finish. When, at the finish, they're like, holy cow, like I can pick up my kid, like I can get on the floor and I can get up, and it doesn't take me like 50 million years to try to get up. It's not painful anymore. So I think that's one of the big reasons why I definitely love it.
The 3 of us being such good friends, I kind of was like, wait a minute, we have a doctor who can do, like the Botox, the filler, the IV hydration, as well as other wellness things. And then I said, we have a doctor of physical therapy who can do, injury care, post and pre-op surgical work. And then on my side, strength and conditioning and nutrition. Why not kind of bring it together and have a full service concierge wellness where we're mobile? In the Wellington community, everything is needed right away. So why don't we just bring everything that we can offer to them, and we can cast a broad net of services to the community, to the equestrian population, and really just serve them. So that's kind of, and we're up together all the time anyway, so why not just kind of come together as a women-owned business? And that's kind of what happened.
And many of our patients, especially going kind of toward the niche of equestrians, but the more we expand, moms, even like teachers, people who are just so busy during the day, who isn't busy these days, they do so much for other people, or they do so much for their horses, for their team, but then God forbid they have to do something for themselves, they come last. They don't have time to make an appointment and drive to that appointment, wait in the waiting room, be seen, drive home. But imagine a service that can come and see them, in their facility that they're working at, between horses, between patients, between classes, whatever, or come to their home before they go into work or after hours or during their lunch break. Like, we kind of had the goal of meeting people at where they were to make these things that they need just so accessible that they can't really say, I don't have time anymore. So now they can put themselves first, and they can put their health and wellness first.
And it's cyclical as far as how it works. You have somebody who's sick or who's injured. As they get better, then they can funnel into recovery, strength, functional fitness. So it's very cyclical. It's very continuous of the wellness that we can give. Yeah. It can go from one person to another to the third, to make sure that person is feeling their best.
Yeah. Or if I have a medical weight loss patient, for example, that the most important part of that is strength training and learning how to eat well, so that when you phase off the medication, you have these really important skills kind of built in to carry you through, continuing to be healthy. So what better way than to have a support system for people like that to learn how to eat well, but also just have constant support beyond just the medication, because we're more than just a quick fix, and we're more than just a pill. Like, we're a whole body approach that can carry you, into the future.
Mm-hmm. Mm-hmm. And we couple things like, boot camp couples really well with IV hydration. So you want to sweat and work out with your friends, and then you want to hydrate afterwards, we can supply that. Or, you fell off your horse and you've got a really tight neck or sore back, Jackie can help you out, and then, we can go from there. So the
possibilities are endless.
It really is. It really is. The possibilities are endless. And like I said, we can cast a large net of services to the community. We are Grand Prix Body WoRX. We offer in-home health and wellness services, anything from Botox to boot camp to physical therapy, for the Wellington community.